Hi y'all, and welcome back to the Montana Physician Assistant Mom. Today I'm going to talk to you about what a physician assistant is and do you want to be a physician assistant? So first of all, my background, originally I was going to go be a veterinarian. So some kids, they play house, some are the mom, some are the dad. I was always the dog. I'm sure that a psychiatrist would have a field day about that. Went to Washington State University, go Cougs, did 4 years in zoology, applied to vet school. I was waitlisted at 4 different veterinary schools. Went home to work and wait to see where I was going to be accepted because I was going to be accepted. 2 weeks into being a veterinary technician, a client came in, her little white dog named Muffin, bit me. The owner was incredulous. "What did you do to my dog?" And my brain exploded. And I just thought, I hate this. I don't want to do this for the rest of my life. So the rest of the summer I spent trying to figure out what I was going to do with the rest of my life. I job shadowed a family practice physician, a dentist, and then an orthopedic physician assistant, also a physical therapist. When I job shadowed the physician assistant, we went to clinic. I also went to the operating room with him. And you know that moment in Elle Woods where the attorney says, "I think she just woke up one day and thought, I'll go to law school." That's kind of what happened to me. I was like, I think I'm going to go to physician assistant school today. So I had to retake some classes. At Wazoo, I took comparative vertebrate anatomy. I had to go back and take human anatomy and physiology, as well as some different communication classes. I was lucky enough that I could do that at my local junior college. Did all the application process. I was fortunate enough to get into a couple different schools. I picked University of Alabama at Birmingham because they had a surgical program. Cornell and UAB both have surgical programs, and I knew that's what I wanted to do. The first year was all in classroom work, so pharmacology, introduction to surgical instruments, those type of things. The summer was a transition period where we did pig lab and then went to the operating room. The whole next year and a half was all rotations. So 1 month would be, oh, you're in inpatient medicine working with a proctor, and they would pimp you, which basically means they ask you lots of questions, put you in situations that you're uncomfortable with. You get kind of comfortable with it for a month, and then, oh, the next month you're in orthopedic surgery, and it's a whole another proctor with a new set of rules, personalities, so you go through that month after month after month. So PA school for me was about 2.5 years. Then I graduated, and I passed my boards, woohoo! And then I got a job as an orthopedic physician assistant. So that's my background. Now the question is, what do PAs do? What even is that? So PA, physician assistant, school is about 2.5 years or so after your bachelor's degree. So the last name is usually physician extenders. The new lingo is advanced practice provider. Basically what we do, we take care of patients. I have my own license number. I also work under the licensure of a physician, so we collaborate. So there's never a time when I don't have access to my supervising physician, even if he's at the master's or wherever he's at the time. So we do assessments, physical exams, plans, we order and interpret tests. We work with all different people in a medical team to take care of that patient. The hours differ. So my hours are usually 45 to 50 hours a week on a good week. If I'm on call, that goes up 60, 70, 80 hours per week. Depends on how many people injured themselves and how many cases we're doing on a weekend. The surgical specialties, I would say, they don't do very well being part-time hours. You have calls, nights, weekends, holidays, all of those things are involved with being a surgical PA. Urgent care, ER, some family practice, if you're thinking, oh man, I don't want to work that many hours, then usually those are set up better to working less hours, part-time, those type of things. The question, so now, do you want to be a PA? Do you think, oh man, that sounds really cool? So question number 1, do you want to be a doctor? If you want to be a doctor, do not go to PA school. If you are excited about having all the responsibility, the final care and treatment plan, maybe or maybe not being the smartest person in the room, then just go to medical school. Medical school is not a good stepping stone into PA school. PA school has its own time, financial burden that goes along with it. You don't want to do that 2 years later and then try and go to medical school. Just go to medical school. The other thing is, if you're wanting the clout that comes with being a physician, you will not like being a PA. Patients will ask you, what are you a PA? Are you a nurse? What do you do? So several times a week, you're going to have to explain what exactly you do. The other thing is, sometimes physicians don't want to talk to you. I've had several instances when a physician was on the phone, would not speak to a PA. That's fine. If they want to speak to physician, that's fine. That's their prerogative to do so. Sometimes being a PA, you have to have a thick skin. So the next thing, have you considered maybe being a nurse? Do you want to spend 12 hours a day really getting to know and take care of a patient and work maybe 3 12-hour shifts? Maybe nursing is for you. How about medical assistant? Do you want to do vitals, do blood tests, urinalysis, draw blood, things like that. X-ray technician, do you want to take x-rays in the clinic, in a hospital, or do you want to go to the OR and use a big C-arm? Do you want to be a phlebotomist and take blood? So if you've run through all those things in the medical field, think, no, man, physician assistant sounds like the right choice for me. That's great. One of the best things about being a physician assistant, you can choose the specialty you want to be in. So if I were to get burned out of orthopedics, I could go to plastic surgery or ENT or family practice or urgent care. There'd be a huge learning curve switching specialties now that I've been in orthopedics for 9 years, but you could do that. If you were a physician and say you were an orthopedic surgeon, you're an orthopedic surgeon, it's rather difficult to then switch and say, oh, I'm going to be an anesthesiologist, or maybe I'm going to go back and be a general surgeon. That's really hard to do. The next thing is, do you want to take a drink from a fire hydrant? Because that's what PA school is. If you say yes, then you should apply. The next thing is financially. How are you going to pay for PA school? PA school for me was about $100,000. I know, right? We'll talk about student loans later. And how are you going to pay? Do you have someone paying for you? Is this all in student loans? The other hard part about PA school is it's not very conducive to having a job. So when I was in school, we had one girl that was a bartender. She worked maybe 10 hours a week. You could do something like that, but really, you need to figure out how you're going to pay for that. So if you want to take a drink from a fire hose, if you're excited to take care of patients, if you can grow a thick skin, you figured out financially and, yep, you've applied, then man, PA school is for you. And the thing you have to remember is, depending on what specialty it is, people do not want to come and see you. When orthopedics, people don't want to be there. They don't want to see me for their sprained ankle or their shoulder pain or their arthritis. They don't want to be there. So seeing patient after patient after patient that's hurt, that's struggling, that just isn't getting better with all the various treatments that we have, that's hard, especially if you take all of their issues on yourself. So just have to also have a good outlet to relieve that stress. So maybe it's reading, maybe it's working out, whatever it is, you have to have that. So 1, you want to take a drink from a fire hose. 2, you have a thick skin. 3, you can financially afford it. 4, you've done the work, gone into PA school. 5, you need to have a good way to relieve that stress. So maybe you want to start training for a half marathon in your spare time as a PA student. And again, PAs, what are they going to do? Man, we take care of patients. And how lucky are we that we get to take care of patients? It really is an honor. Even on those days where you think, oh man, if one more person complains to me about something, I am going to lose my mind. In the back of your mind, you just have to say, man, how lucky I am that they're. Anyway, being a PA is a privilege. So if that sounds good to you, do it. You won't be sad that you did it. So anyway, if you have any questions, comments, I'll be happy to help you out. If you like this video, like, subscribe. See you soon.